Hi, I hope this finds you well. So today I want us to go through factors that normally affect the health of children right after they're born. Some of the diseases or the infections, and also some of the factors that may also affect the health of these children. And some of these factors that normally affect the health of these children includes balance and adequate diet, whether they're able to access a balanced diet, and also adequate that is sustainable throughout the life of these children, whether they're able to live in a place or in an environment that is of good sanitation and hygiene, whether they're able to access clean and safe water, whether they are living in a poor or well sanitated area. Also, another factor that may also affect the health of children is the fertility rate of their mothers and their parents, increasing population growth in whatever place that they are living in, poor maternal services, so other factors that may also affect the health of children includes also maternal education, the level of education of the mother, the status of the mother economically. Is the mother able to take care of the child? Does this mother only depend on the father or whoever that is the breadwinner in the house for upkeep, poverty levels, and many other factors? So these factors will affect in one way or another, or indirectly, the health status of children. Let's take, for instance, the maternal education. If the mother is educated, they will have some level of knowledge when it comes to nutrition. How am I supposed to feed my child? Am I supposed to only feed my child one kind of a food? For example, am I supposed to give this child eggs before they're even 6 months? Am I supposed to give this child any food before they're 6 months? Am I supposed, what about the combination of the food that I'm supposed to give this child? So they will have some level of education, even if not all that is needed, but at least they will have some level of knowledge on how to take care of the child. If, for example, the child presents with these symptoms of a certain disease, when the child develops fever, what am I supposed to do? And why are they developing this fever? So if for mothers who are educated, they have more knowledge or understanding of the requirements of this child. When it comes to maternal health services, if the mother is not sick, they will be able to take care of the child. But if the mother didn't get good quality services for antenatal, postnatal, during delivery, definitely the mother will be sick, or they will not have the right status of health, and due to that they will not be able to take care of the child as it's supposed to be. So a lot of these factors will affect the child or the health status of the child, either indirectly or directly. When it comes to personal hygiene of the mother, of course, if the mother has good personal hygiene, they'll be able to make sure that the child lives in a clean environment. They're using clean utensils. They're also preparing the food in a clean environment. The food is clean. The food is safe for consumption. And if the mother have poor personal hygiene, definitely this child will be exposed to a lot of microorganisms that may cause infections to this child. So as you can see, these factors will affect the health status of the child in one way or another. So some of the factors or some of the issues that normally happens or that normally affects the child includes, the first one is perinatal mortality, and this is the number of fetal deaths or late fetal deaths which is also includes the fetus that are normally born well dead or stillbirths, and early neonatal deaths that includes death of a child who has been born and stayed for up to 7 days. So the first week, if the child dies during the first week, we refer to that death as perinatal mortality. So this is the number of deaths of late fetal deaths. The fetus who is about to be given birth, as well as the fetus who was alive up to the last point and died during delivery, and also a fetus or a child or an infant who have been born, or a neonate, we call it them neonates, who have been born and have died the first week of life per 1,000 births. So this is the number of deaths that occurs during the late period of pregnancy, during birth, and the first 1 week, over 1,000 births. So deaths of all fetuses and newborn with a birth weight of 500 grams, that is gestational age of 22 weeks, from 22 weeks up to the time the child is born, and if the child dies within the first 1 week, we call that as mortality, or it belongs to the perinatal mortality, or perinatal deaths. What causes perinatal mortality? These are some of the causes of perinatal mortality. It is caused by a lot of causes, and some of these causes include, number one, low birth weight. If that child was born with very low birth weight, it means that some organs are not yet formed, and this child may be at risk of dying. When it comes to cord prolapse, when the cord have prolapsed, then we have asphyxia. When this child was being born, they were depleted of oxygen. Birth injury, maybe the child was injured during birth. Congenital anomalies, we have birth defects here. Sepsis, this is infections. Neonatal tetanus, if for example the mother was not given any vaccine or any tetanus vaccine, this child is also at risk of getting these neonatal tetanus. Then complicated labors, maybe through prolonged labors, obstructed labor, breech labor, transverse. A lot of these complicated labors also causes perinatal deaths. Mismanagement of labor, maybe this person did not have a good midwife, or a good person, or a trained personnel to help them deliver well. We have hemorrhage, we have maternal age, if the mother was old, maternal or very young, maternal anemia, maternal health problems, maternal infection, parity, placental insufficiency, ruptured uteruses. Mother's utilization of health services may also cause death to the unborn child or during delivery, because if that mother had issues or complication of pregnancy and they did not go to the hospital, or they went to a hospital that did not take good care of these mothers, they didn't go to any antenatal clinics, they didn't go to any prenatal clinics, they didn't see any specialized person to take care of some of these complications, they also that may also cause perinatal death. Then we also have maternal education. If the mother have knowledge, if the mother is knowledgeable on some of these aspects, when it comes to, if they're knowledgeable such that if they notice something happening to the child and and identifies that this child is not well, this child have some maybe issues, they are able to go to the hospital, but if the mother do not have any knowledge on how the child should be taken care of, do not even know when the child is having any issues, and that may also cause death in the children. Another factor that also will affect the health status of a child, this is the first one. The previous slides were on perinatal deaths. Now we are on factors that will affect the health status of a child. The first factor is low birth weight. And low birth weight is an extremely important factor predisposing for perinatal mortality. Because the perinatal mortality rate for low birth weight baby is 5 to 30 times higher than the fetuses or infants with normal birth weight. So it's really important to know this, or for mothers even to know this, or to have this knowledge that when a child is born of low birth weight, they have a higher risk of getting infection and also dying. Then low birth weight infants who survive may have serious neurological problems and hearing and visual defects, and may subject to slow development throughout life. So low birth weight children normally have their organs are still yet to form. Their organs are still yet to be fully formed. So they end up, when they survive, they might end up, not all, but some might end up having some issues such as neurological problems, problems of the brain, problems of the nerves, problems of the spinal cord, and hearing, as well as visual defects, and may be subject to slow development during life when it comes to IQ, when it comes to a milestone, and other factors. What causes low birth weight in children? Number one is low pre-pregnancy weight. If the mother didn't have the right weight before they got pregnant, this is also a risk factor to giving low birth weight children. Another one is inadequate weight gain during pregnancy. During pregnancy, it's really important that the mother know that they need to eat well and rest in order for them to gain weight, because they need to gain enough weight in order for the child, or they need to eat well in order for the child to get enough nutrients from the mother, and that will help them to grow. In fact, the minimum amount of weight that a mother should add is 10 kg. So if you are 60, you need to be 70 and above once you become pregnant or during pregnancy. Then we have anemia, can also cause low birth weight. And this anemia, one thing you should know that children normally stores iron. Fetuses, not children. Fetuses normally stores iron at the late stages or late trimester. That is the third trimester, that's when, or the late months. The 8th month, the 7th month, and the 9th month, that's when an infant normally store iron in them, or iron in them. So if the mother didn't take enough iron during pregnancy, and especially those times, or the late stages of pregnancy, then this child will be born with less iron in them. And since milk is a very poor source of iron, this child may be subject to anemia. So it's really important that pregnant mothers start to take iron and folic acid supplement the moment they notice that they have pregnancy. But the majority of women, especially in Kenya, will find that they normally take this iron and folic acid supplement when it is too late. In fact, folic acid supplements should be taken 1 month before you get pregnant. And because the majority of women normally notices that they are pregnant after maybe a month, so it is more important that if you are not planning for that pregnancy, you start the iron and folic acid as soon as you notice that you're pregnant. And also, if you had planned for the pregnancy, you can take 1 month prior the iron and folic acid, and especially the folic acid 1 month prior to becoming pregnant. So it is really important to encourage intake of iron-rich foods as well as iron supplements when you are pregnant, in order to ensure that your child have full stores of iron once they are born and also during the time they're in the womb. Then we also have reproductive tract infections. If the mother had reproductive tract infections and also the child have also these reproductive tract infections, this puts them at risk of getting low birth weight. Then we also have other infections during pregnancy. For example, women suffering from malaria in sub-Saharan Africa give birth to an estimated 3 million severely underweight babies. A woman with HIV also has 25 to 40% chance of passing the infection to her fetus in the womb and at birth. So these are some of the causes of low birth weight in children. And I've said of 4. We have low pregnancy weight, inadequate weight gain, anemia, as well as reproductive tract infections in the mothers. Then we also have some other infections that may occur during pregnancy, such as malaria. We also have HIV and AIDS. We also have hemorrhages during pregnancy. We also have hypertension, that is eclampsia during pregnancy. So these are some of the issues that may cause the child to be born of low birth weight. Then also some other effects or some other factors that may affect the health status of the child is poor management during labor and delivery, associated with development of impairments among children. So majority of children with issues or with birth defects normally develop them during delivery or during the time they're delivered, because maybe there were poor management of labor or poor management of this woman during labor and delivery, and due to that, this child maybe was exposed to asphyxia, which when it occurs in the first minute of life, it normally kills and causes the brain damage, which normally results to cerebral palsy. If the brain is damaged once this child is being born, because maybe there was poor management of this and pregnant women during delivery, this child may develop cerebral palsy, may also develop other birth defects because of this poor management of labor. Then we also have maternal death. If a mother dies, the fetus is normally affected in a lot of ways, because in fact they will not be able to access colostrum, they will not be able to access the maternal even bond between the mother and the child, will also not be able also to access the breastfeeding for the first 2 years, and this will definitely affect the health status of this child. This child will be exposed to cow's milk, which normally comes with its own issues on diarrhea diseases. They will also maybe exposed to other formulas that may also affect their health by bringing about these diarrhea diseases. So the overwhelming majority of pregnancies that end in maternal death also results into fetal or perinatal death. Among infants who survive the death of the mother, fewer than 10% live beyond their first birthday. So you will find majority of children normally dies once the mother dies in the first, once they're born. Another issue that normally affects the health status of children is diarrhea diseases. And the diarrhea is the passage of 3 or more loose watery stool in 24 hours. You're not supposed to pass more than 1 or even 2 loose stools in a day. But if you pass more than 3, then we say that you have diarrhea. And if this diarrhea stays for more than 14 days, that is 2 weeks, then we say you have a persistent diarrhea. Diarrhea is most common in children, especially between 6 to 2 years of age, or 6 months to 2 years of age, sorry. And it is also normally common in infants who are on cow's milk or infant feeding formulas, because the cow's milk will be forced to use cups, you will be forced to use other, maybe cut or even a spoon, that will expose this child to microorganisms, which normally causes this diarrhea. And also the case of cow milk and infant formula. So in addition to bringing death, diarrhea is also a significant contributor to the development of malnutrition. And how do malnutrition being brought about by diarrhea? Diarrhea normally diminishes the appetite of this child, and if this child does not eat or feed according to how they're supposed to feed, what will happen to them? They develop malnutrition. If this feeding is interrupted, feeding is normally interrupted by this diarrhea, definitely they will not be able to access adequate nutrients. Then diarrhea also leads to loss of a lot of nutrients and electrolytes, because digestion is also interrupted, and due to that this individual will not have enough nutrients in their body, and due to that they will develop malnutrition. Malnourished children then become more vulnerable to infections, creating the potential for a vicious cycle of malnutrition and infections. They're normally vulnerable to infections. Once someone is malnourished, they are not able to have enough immune system, or strong immune system, because they have less immune cells. And due to that, they'll be exposed to a lot of infections. An infection now brings about low appetite, diarrhea and vomiting and the likes. And due to that, they also leads to malnutrition. So it's a vicious cycle. That's why I'm saying it's a vicious cycle. Malnutrition leads to infections. Infection also leads to malnutrition. So malnutrition is a contributing cause in approximately 1/3 of children's death or child's death. When it comes to marasmus and it comes to kwashiorkor, all these are causes of 1/3 of causes of death in the world. So other factors that contribute to death due to diarrhea includes short birth interval, acute respiratory tract infections, measles, as well as malaria. When the mother is very untidy, or if the mother do not observe personal hygiene, or this child is brought about in a poorly sanitated area, they are at high risk of developing diarrhea diseases, because they will be exposed to a lot of these bacteria that normally causes diarrhea diseases in them. And the primary cause, or the primary source of this bacteria that normally causes diarrhea is human feces. So that's why personal hygiene as well as sanitation must be optimum for this child to overcome diarrhea. So the agents may be transmitted to the child in a variety of ways. Number one is direct contact with feces through another person's dirty hands. If the mother or whoever is taking care of the child do not practice personal hygiene of cleaning their hands after they are going to the toilets, before they handle the child's food, before they clean the child's utensils. So all these may cause a direct contact with the person's dirty hands. Then direct contact with the child's crawling on unclean surfaces. If wherever this child is playing around, or the toys they're using is contaminated with human matter, human fecal matter, it may also cause the transfer of the bacteria to the child. And remember, children normally likes to eat whatever that is around them, eat their hands. So due to that, they will be exposed to a lot of this microorganism that causes the diarrhea in them. So indirectly, it is normally through contaminated water, which is then transmitted to the child through drinking water, bottle of formula, or even weaning of foods. Indirectly can also be through water. It can also be through hand transmission during preparation of weaning foods. And this is the most common method of transmission of this bacteria to this child. If the person preparing the food, if the person cooking the food, if the person giving the food to this child do not observe personal hygiene, definitely they will pass the fecal matter to the child. If the child does not recover, prolonged or severe diarrhea will usually lead to dehydration. If the diarrhea now and then they're exposed to this microorganism each and every day, definitely this diarrhea will be persistent. And when this diarrhea is persistent, they will lose a lot of water and electrolytes, and this may cause dehydration. How do we treat dehydration in our home? You don't need to go to the hospital once a child diarrhea once. So you just need to give them the ORS, or oral rehydration therapy. You can either use ORS or Resomo, that is normally sold even in our pharmacies. You just dilute the ORS and the Resomo in water, and you rehydrate this child. And that is not a medication. Its main purpose is to rehydrate or replace the already lost water during diarrhea. It is less expensive. It is very cheap, in fact. Then this makes it less dependent upon highly trained health workers and fixed facility, and compensates more quickly for nutritional loss due to diarrhea diseases. You don't need to go to a hospital. You don't need to go and use a lot of money. You just need to give the ORS when this diarrhea is not persistent. But when it is persistent, you also need to go to the hospital in order for the child to be given some antibiotics. So some of the factors that normally that needs emphasis in prevention of diarrhea definitely is observation of personal hygiene, and this is through adequate feeding during and after diarrhea. Remember, they have lost a lot of nutrients, so you need to adequately feed to replace whatever the nutrients that were lost during diarrhea. Then you can give them breast milk, you can give them diluted formula, you can give them regular foods if at all you're dealing with children. And also you can also encourage these mothers to have these Resomos in their homes, because they won't be bringing the child to the hospital each and every time the child's diarrhea. What happens if the child with diarrhea like 4 times in a month? So they just need to rehydrate the children using Resomo. Then another thing is that you need to emphasize on the support of breastfeeding for its immunological properties. You need to encourage these mothers to continue breastfeeding the mother. Remember, the breast milk normally contains a lot of antibodies that will protect this child against a lot of these microorganisms or a lot of these bacteria that are normally leading to development of diarrhea. Then also encourage improved weaning practices. What is the difference between complementary and weaning? We normally wean after 2 years once you stop breastfeeding. We normally use complementary feeding the time that you want to mix both breastfeeding and other family foods. So you need to encourage and also emphasize on the best foods to give to this child, and to make sure that that food is well balanced. Then emphasize on use of clean water, emphasize also on proper storage of foods and use of clean utensils, proper hygiene, proper sanitation around the child wherever they are praying, immunizations against things like measles, health education, which normally builds up an understanding of traditional practices and beliefs in order to promote positive changes. You need to discourage some of these traditional practices that normally exposes this child to a lot of these infections. Then surveillance, to determine prevalence and incidences of these diarrhea diseases in order to come up with the interventions that may help this child. Another infections that is normally affect children's health is malaria, and it's very common in sub-Saharan Africa. Where do we get malaria from? Mosquitoes. How do mosquito comes in? Through stagnant water, through bushes around. So if you understand the cause of malaria and the mode of transmission of malaria, you'll be able to prevent these women together with their children from malaria infections. So although persons of all ages can get malaria, there are two groups that are highly vulnerable to malaria, and that is pregnant women and children under the age of 5 years. Those are the most vulnerable to getting malaria. And to reduce the effect of malaria on these high-risk groups, certain types of treatments are normally necessary. For pregnant women, it is important to provide prophylactic treatment with drugs such as chloroquine in order to prevent the risk of abortion of fetus or low birth weight of neonates. Because malaria is a very risky disease during pregnancy, because it can lead either to abortion, it can also lead to low birth weights, can also lead to anemia in the mother, and which will also expose this unborn child to a lot of issues. So it is really important to make sure that we are preventing malaria from occurring to these pregnant women. And the government of Kenya has come up with an intervention of, number one, giving health education to these pregnant women, and number two, providing them with nets or mosquito nets in order for them to use in their homes. In areas where malaria is endemic, where areas where this malaria is common, such as in the coast regions or even in Nyanza province in Kenya, it is recommended that presumptive treatment be given to young children. That is, to treat all young children with drugs when it appears that the fever is due to malaria, and that the child will respond to treatment with chloroquine or other appropriate medication in the case of chloroquine resistant areas. So it is really important when you're dealing with an endemic disease in a place that you make sure that whenever the child develops some symptoms that suggest that this is malaria, you be very cautious and also prompt in order to treat this disease before it spreads to other children in the region. Another issue that normally occur in children that affect their health is vitamin A deficiency, and that's why in Kenya we normally give vitamin A supplements after every 6 months for the first 5 years of life. And also we also encourage the mothers to provide or to give their children a lot of this vitamin A during the 5 years of life of the children. So vitamin A deficiency is a public health problem or concern in Kenya and the rest of the world, and affects many children subclinically at a severe or moderate level. Some preschool age children have eye damage due to vitamin A deficiency, and more than 250,000 preschool children go blind each and every year, because once you don't prevent vitamin A deficiency from occurring, it will lead to development of night blindness. Night blindness, if it is not mitigated or if it is not controlled, it will progress or graduate to vital spots, which will graduate later to xerophthalmia, which will graduate later to cirrhosis, and lastly, the child becomes blind. And this is because just merely of vitamin A deficiency. So it's a very much health concern that really need to be taken care of by the entire community. So recent findings have indicated that vitamin A is a key modulator of the immune system and may play a role in preventing the development of cancer. It is also have been shown that vitamin A normally boosts immunity, as well as makes the part that normally protects the body from the entry of microorganisms, such as the gut, the epithelial tissues, or the tissue that normally lines the gut, that is the gastrointestinal tract, is normally strengthened by vitamin A. So if you have less vitamin A in your body, you will have less immune cells, or your immune system will be diminished or deteriorated, and also microorganisms can enter your body very easily. So sufficient vitamin A stock could significantly reduce the risk of transmission of HIV from infected mothers to their unborn child. So in Kenya, we have programs that we normally provide supplements, as I've already said, to children below 5 years. After every 6 months, they're supposed to go and take vitamin A supplements. We also encourage dietary modification by improving food availability that are rich in vitamin A. And these are foods that are normally yellow, red, or orange in color, normally contains vitamin A in them. So breastfeeding protection and promotion is also enhanced in order to make sure that children have adequate vitamin A. Food fortification with vitamin A, supplementation, I've already said that. Public health measures such as components of primary health care to ensure that mothers going for the clinic, the children are given the vitamin A. And also, we also have areas where the vitamin A is taken to the children, wherever they are, when it comes to school, when it comes to their villages. Health workers normally go and distribute this vitamin A. Right now, less people are going to clinics. What is happening? The health workers are now sent to the villages in order to supply or even to give these children vitamin A. What is the role of breastfeeding in preventing vitamin A? So promotion and protection of breastfeeding is a fundamental aspect of vitamin A deficiency. Breast milk is virtually the only source of vitamin A the first few months for many infants. Because they're not taking any other type of food or any other source of food, milk is the only food for them, then the mother are supposed to have a lot of this vitamin A in them in order to pass them through breast milk. So without breast milk, newborns can maintain optimal vitamin A for no more than few weeks. So they will be depleted of this vitamin A. And that's why women who give birth in the hospitals, they're normally given this vitamin A after delivery, in order for us to make sure that these women have adequate vitamin A, and having adequate vitamin in them, they will be able to give the unborn child vitamin A. So although vitamin A concentration in human milk are dependent on the mother's vitamin A status, vitamin A deficiency is rare among breastfed infants, even in parts of the world where vitamin A deficiency is endemic. So promotion of exclusive breastfeeding for the first 6 months and continued breastfeeding up to 2 years, it's really emphasized in order to ensure that these mothers are not only giving vitamin A to their child or to their children, but also they're giving the children other benefits of breastfeeding. So those are some of the health issues that normally affect the health status of children. And we have the main one is diarrhea, another one is low birth weight, and another one is vitamin A deficiency, as well as malaria. Then remember, this is not a disease. This is the death of children at the late phases of pregnancy, during delivery, and in the first week of life. So I hope this you've understood the contents of this presentation. And if in case you have any question, you know how to reach me. So all the best, and God bless you all.